specialized in colon pathology. It's been really well, I should go on, but I also must mention the auxiliary women, the twigs, who for years during the war and after that, my wife was among them, folded sponges and for sterilization, and stopped doing that when it became more effective to use packaged material. They then devoted themselves to volunteer work and to fundraising. We've lost a great institution here. I feel it's a legal crime that closed this hospital because it's left the community without quality medical care. And I hope, and I bless you all for trying to reestablish that hospital. It will not be the same, but it'll be something. Thank you.
Yeah.
Thank you, Doctor. You're fortunate to have another high-level state official with us, and that's Assemblyman Jerry Green.
Thank you very much, Dottie. You know, looking around, still like it's a nightmare that this has happened. But the reality is that it's far from over. I don't want to mislead anyone because of the fact that I've been in constant communication with the new commissioner. She's looking at the whole process. Number two, recently we had a problem with the ambulance. Again, we're looking at that particular issue. So now's not today to be critical of anyone because they inherited this problem that we had. And some of the things already have shown that we were not being treated fair. So again, I'm hoping that the city will come together because it's obvious in another 2 or 3 years they're going to have to do something with this campus. And we're hoping that it will be part of medical support that we get in the community. So I want to go on record saying that the front office is well aware. That includes the governor and the commissioner. And the bottom line is that Solaris is going to have to deal with the city and the council with this particular facility, as well as making sure that we get some type of medical support. So again, I want everyone to be thankful that there is some hope. But at the same time, I want to personally thank you for coming out this evening and keeping our hope alive. The reason why I say let's keep our hope alive, today the President of the United States made a commitment to education. The condition of the health here in the state of New Jersey is just as bad. And I'm hoping that if he makes that kind of commitment to health, then maybe we have an opportunity to say that we can do something about Muhlenbeng. So again, all I ask everyone in the community, continuously do what you're doing. Don't give up, but at the same time, let's be positive about it because being negative does not get us any place. Again, thank you very much for listening to my remarks.
Thank you, Assemblyman Green. I would like to call up to the mic now Dennis Bazzi, who is representing Reverend Carolyn Eklund of Grace Episcopal Church, who did an awful lot of the work to pull this event together. Dennis.
Good afternoon.
Hold it close to your mouth.
Reverend Carolyn was unable to be here this afternoon, not because she didn't want to be, but because she's out of the country. As a member of Grace Church, she asked me to convey that message to you all. She was instrumental in getting this group here together. She asked me to give thanks to VOB, Restore Muhlenbeng, the people of Plainfield, the leaders of Plainfield. She also asked, made a special request. She said, even though that we have failed so far, and I shouldn't say failed, that we did not get the approval to continue keeping this hospital open, she do hope that the leaders of this city continue to make make plans so that we can get and look into health care for this part of this state. So with that, I wish you the best. Thank you.
God bless you.
Dennis, thank you very, very much. One of our consistent support and for keeping the fight in this ongoing struggle going. Speaking for all of the freeholders, I just want to say that we stand with you in doing whatever we can to ensure quality, affordable health care for Plainfield and for all of Union County's residents. Unfortunately, the closing of Muhlenbeng was not an isolated incident. Healthcare is in crisis throughout the nation. We just are feeling it especially intensely here. We all know what an excellent institution Muhlenbeng was, and we want to bring it back to that. We support the efforts of Assemblyman Green, who, as he told you, has been in negotiations with the state. We support the efforts of all the community groups represented here, and of course we support President Obama's reforms, which, granted, are not going to be the answer to everyone's prayers at the moment, but it's a start, and we are going to move health care reform forward to make life better for all of our residents. So I just want to thank everyone and tell you we will continue to stand with you, and we will continue to work towards better health care for all. Thank you. Good night. Thank you, Betty Jane Kowalski. Now, one of the people that you all will...
The main point that I've always tried to make is that it is not a Plainfield issue, it's a regional issue. There's 14 towns that were served by Muhlenbeng Hospital, some of them exclusively, Plainfield, North Plainfield, Fanwood, Scotch Plains. It's really the only hospital that was nearby. And a number of other towns, parts of the towns, had Muhlenbeng as their closest hospital. Warren, Watchung, Greenbrook, Dunellen, Middlesex, Piscataway, South Plainfield, parts of Edison, parts of Watchung, a lot of towns in the area. Really, Muhlenbeng was the nearest hospital. And we think that Plainfield has suffered extensively because of the employment issue, Muhlenbeng being the biggest employer in Plainfield. South Plainfield, too, was extensively affected by that. Several hundred South Plainfield residents were employed there, making it one of South Plainfield's biggest employers as well. So it's not, if anyone says, oh, it's Plainfield's fault, it's Plainfield's problem, you back them up with the data that I've just given you, that it's not just Plainfield's problem. We at United Way are certainly concerned with health, education, and income. Those are our three key areas.
Thank you, Dottie. I can't say that it is a pleasure to be here because
The airplane that came in.
No, you said something about the people.